Hi, I'm James Zervios, Vice President and Chief of Staff of the Obesity Action Coalition. In today's episode of Fresh Perspectives, we'll be sharing an update on some of OAC's advocacy efforts to kick off Obesity Care Week. Starting today, March 4th through March 8th, it's Obesity Care Week. Obesity Care Week is an annual event focused on raising awareness, educating, and advocating for a better world for people living with obesity. This year, our goal is to spread awareness about the 5 principles of obesity. These principles are crucial for understanding and supporting individuals affected by obesity. Head over to obesitycareweek.org to learn about the 5 principles of obesity, sign a pledge, and find out more ways you can take action. Let's raise awareness and make a positive impact together. Now let's hear from Dr. Tracy Zvenyach, Director of Policy Strategy and Alliances at the Obesity Action Coalition, and Joe Nadglowski, President and CEO, about all the advocacy work happening at the OAC.
Thanks, James. Hi, everyone. This is an exciting week for OAC. We have dozens of advocates in Washington, D.C. today, talking to their legislators and sharing their stories about the need for access to obesity care. The top federal policy we're trying to update is Medicare coverage for obesity care, including intensive behavioral therapy and FDA-approved anti-obesity medications. The bill that would do this is the Treat and Reduce Obesity Act.
That's right, Tracy. The Treat and Reduce Obesity Act would improve access to these obesity treatments by removing outdated restrictions in the law. Today, the law prohibits coverage for FDA-approved anti-obesity medications and limits who and where a person can receive intensive behavioral therapy services. These outdated policies need to change for people living with obesity.
And that's why we have our OAC advocates in DC today. The Treat and Reduce Obesity Act continues to gain support from lawmakers in Congress. There are over 20 senators and over 65 representatives from the House that support the bill. We're hopeful that the bill will gain more traction this spring and over the course of this year. Lawmakers want to hear from us, and the more voices we have will help to increase support for policy change.
In addition to our federal work, we are also working on issues at the state level, like changing policies in state Medicaid programs, state employee health insurance, and the Affordable Care Act exchange marketplace plans. OAC is working to improve access to obesity care in over 35 states, and we are also supportive of a handful of states that have introduced legislation that would prohibit weight-based discrimination. So in addition to access to care policies, OAC is fighting to reduce weight bias and stigma. We need you, our OAC advocates, both at the state level and in Washington, D.C.
So we invite you to join us. If you're interested in keeping up with OAC advocacy efforts at the state and federal levels, be sure to subscribe to our advocacy newsletter, Impact Now, and follow OAC on social media to learn ways that you can take part from home.
Here are some simple but impactful ways you can make a difference. You can add your name to the 5 Principles of Obesity Pledge. You can urge your legislators to support the Treat and Reduce Obesity Act. You can make a donation to help us continue our advocacy work. Thank you again for all that you do. Goodbye.